Well, when you're a parent, you know the worries seem endless, but how do you know when your child's pain is actually something major? Dr. Clint Cappiello is a pediatric surgeon at GBMC, and he's here to talk today about appendicitis. Welcome.
Thank you for having me.
I'm happy to have you here because you literally just came from surgery, right?
Correct.
Okay, so we're talking about appendicitis. What are some of the symptoms that we should be on the lookout for?
Sure. This is just so parents know, it's the most common abdominal emergency that we deal with in kids. It's about 75 or 80,000 done a year.
Wow.
We just did about 10 last week, one of my partners who was on call, and we just finished one this morning.
My goodness.
And so the symptoms parents want to look for is sort of a stomach ache that starts usually around the belly button.
Okay.
It's sort of vague, often associated with anorexia, not wanting to eat, even offering their favorite food, they have low interest in it.
Okay.
And that pain then tends to migrate to the right lower quadrant, the area we talk about between the belly button and the hip bone.
Okay, so it starts sort of in the belly button and then goes to
the
right lower quadrant. And
Correct.
so I think I have a 5-year-old, and kids all the time, my tummy hurts.
Sure.
So how do you know when it's not my tummy hurts to this is major?
Sure. Generally, it's persistence.
Okay.
We think of appendicitis as sort of a 24 to 48-hour process. That first day or two is as those symptoms begin to crescendo, the pain won't go away. A lot of kids are just constipated or they ate too much.
Right.
They get better. They're up running around in no time.
True.
So
Yeah.
pain that persists and then localizes gets worse. And then if the pain precedes nausea and vomiting, that's also sort of a telltale sign for us.
Okay, so what are some of the risk factors? Is it a certain age that you're more prone to this, or gender
So
even?
we see kids up to 18.
Okay.
Generally, we stop at around 17, but we do some young adults also. And there's hard to say a risk factor that a parent can really control. We know that younger kids tend to come in perforated, which is the more severe form of appendicitis, because they can't elaborate their symptoms.
Right, so it progresses a little bit longer.
Correct.
Okay, got it.
Some parents will ask, well, was it something they ate?
Yes.
Something that we did? Not generally.
Right.
Sometimes a infection may precede it, and that causes expansion of the lymph tissue that helps you fight infections near the appendix, and that blocks the appendix off. And when that tube can't drain anymore, it's like a water balloon. It just fills up with infection, bacteria, then not enough blood gets in, and then it becomes
Sounds super
diseased.
painful.
It
So
is.
I'm wondering, with surgery, I think you always have to have surgery, but I don't know. Do you always have to have surgery?
So generally we operate for appendicitis.
Right.
That's the short answer. The longer answer is that there are places that manage this conservatively with just antibiotics and have a good success rate.
Really?
Early success as high as 90%. That being said, you don't remove the appendix, so recurrences are not uncommon.
Got it. So that is a way to avoid surgery, but maybe temporarily.
Correct.
Okay. And so when they do the surgery, what is sort of the recovery time for that?
So we do almost all of these laparoscopically now,
Wow.
using 3 small incisions. One basically through the belly button, one over the bladder, and then one just outside of your six-pack muscles on the left side.
Okay.
The incisions are very small. Kids usually recover well with just Tylenol and Motrin. And if it's not perforated, kids can go home even the same day.
That's what I was wondering, how they function afterwards. So you're saying a little kid that has the surgery will go home the same day, or could go home the same day?
Kids do great. Now, if
Wow.
it's perforated, the
Right.
average hospital stay nationally is about 6 days.
About 6 days. Okay. So just for parents, we just need to be on the lookout and actually listen to the kids. Don't
Correct.
dismiss, it's just a tummy ache, but really
Correct.
pay attention.
Pain that persists, a fever, pain that then localizes to that right lower point, basically draw an imaginary line from the belly button to their hip bone. Right in the middle there is sort of that focal point for classic appendicitis.
Okay. And in that case, should they go to their regular doctor, the pediatrician, or just go on to the hospital right
So
away?
if there are pediatricians available to see them the same day with a good story, the pediatrician's going to pick up on early appendicitis.
Okay.
If the kid is really sick, it's the middle of the night, vomiting,
Right.
fevers, you may
Don't
not
wait.
have that luxury.
Just
Bring them to
go.
the ER and we'll get them sorted out for
Okay,
you.
great. And so they can do that. For more information, they can go online or just call GBMC's Pediatric
Correct.
Surgery Department, correct?
Correct.
Great. Okay, that number is 410-324-5100. Dr. Cappiello, thank you so much for being here.
Absolutely.
Really appreciate you being here and putting our minds at ease as parents. This is really something to pay attention to. We'll be right back right after this. Stay tuned.